Hey everybody, it's Kathy Boyle, president of Chapin Hill Advisors. Today we're interviewing another member of our Circle of Influence. We've created our Circle of Influence to allow our network to find experts who they can trust. Finding a great expert in whatever area you need is actually very difficult. You can make a big mistake because a lot of times you're in a hurry. You reach out to a friend or a colleague and say, who did you use? And if that person is not up to your speed or doesn't speak to you in the same language that you understand, you can have big mistakes. And making a mistake with an expert is expensive in terms of time and money. I don't know anybody who has either to waste. So get it right from the get-go using our experts in our circle. You can find them on our website, chapinhill.com, and there's a drop-down menu where you can search. So today we're interviewing a very interesting specialty. This is McGuire with HealthCare Pathfinder. So Anne, let's talk about the very big picture. What is it that your company provides?
Okay, so we provide healthcare advice and advocacy services to individuals, families, and company employees. We help our clients find, understand, manage, and advocate for their health insurance benefits. So we have 4 key areas where we provide services, and it's consultation services, projects, case management, and then retainer services, which are ongoing client management.
Okay, so let's talk about one of the likely retainer services. So when people have an autoimmune disease like lupus or are afflicted with something that doesn't kill you immediately like Parkinson's or Alzheimer's, you're going to need care and medication for a long time. So in those situations, give us examples of how you might be of service.
So these are great clients, especially if we can get them early on, because we can be very proactive with their coverage and understanding their benefits. And it's really helping them make sure that that we review their coverage, make sure they're on the best coverage that they can get, and then really working with them along the way when they receive treatments with new medications, helping to make sure we're communicating with the doctor's offices, with the insurance company, and submitting claims and being proactive with authorization. So it's an ongoing process of really, as we said, it's sort of, finding, helping understand, managing, and then advocating for their coverage.
Got it. And I think in some cases, this again is very difficult for people, it's challenging. And one particular patient, an ALS patient you have, you've been able to save them as much as $5,000 a month in medication costs.
Exactly. And again, initially when people get a diagnosis, they often just start going to providers and just going out looking for help, writing checks to doctors who do not take insurance, not realizing that we could maybe get this covered initially under the insurance. But then again, it goes into claims management and just trying to avoid denials and supporting them along the way so that they can call us and we can just help advise them so they can understand their benefits.
Got it. And then I think another large area that we see a lot of when we do a financial plan, whether it's a business owner or family, we go up and down generations looking for risks. So very often we're dealing with parents with Alzheimer's, Parkinson's, dementia. So in those cases, if they do have long-term care policies, which we advocate for, because
Yes.
if you have a cash flow coming, there's less likelihood that children will see their inheritance burning up. But there's a lot of denials within the areas of long-term care. So let's talk a little bit about that for a minute.
Oh, that's so true, Kathy. We deal with so many clients with long-term care insurance and working with the children as well and helping to initially go on claim with, if we can find out is even before they start hiring maybe home care services, to help them choose the right providers or caregivers and understand whether or not their insurance policy requires them to have certain, licenses, et cetera. So really understanding the benefits from the beginning is extremely important to avoid denials, but also submitting the claims, tracking the claims. There's a lot of errors as to how the insurance companies process the claims, but it's also how, say, the home care agencies bill the provide the insurance company. I've had significant claims issues with home care companies. Their systems don't bill correct the way that the insurance company processes claims. So that's important. And then negotiating with long-term care facilities and home care agencies on their pricing to fall within the daily limit. And again, it's just working with them and helping to make sure everyone understands the benefits.
That's terrific. I think that's a very big service. I do know that I had one woman who had coverage of about $250 a day on her husband, and she told me by the time she got through with all the denials, she only got about $125 a day. So that's, you're paying for $250 a day and you get $125. So let's talk about families. What might you do with an extended family?
Well, with an extended family, I mean, you can start with just having the children of older parents who just need us to be available to help understand their insurance, make sure their parents aren't on an old Medicare plan, that they have all of the coverage that they need, that, that understanding the plans that they're on, and there are opportunities to change those plans. And we can make those transitions. We work with brokers. We do not sell insurance. We're licensed to sell insurance, but we do not. And we work with professionals to do these transitions if they need to change their benefits. And then going through with working with, we have worked with generational type of clients, some which is very interesting, where they don't have an employer, they don't work. So again, it's finding the opportunities and the right coverage for their needs.
Got it. Okay, and let's talk about your unique background and how you started in healthcare.
So initially started when I was 14 as a volunteer for a local ambulance, and became an EMT when I was 16, and then went to nursing school, worked at in surgical trauma intensive care at Yale New Haven Hospital in Connecticut, and then ended up working for a home care agency, which I absolutely loved. And that's where insurance I started to understand how insurance worked. And then I went to work for a managed care company and worked for a managed Medicare product. And then we moved, and I started working for a company helping to advocate for clients' health insurance benefits. And I was so excited to help clients understand their coverage and help them get the coverage that they deserved, and really help them through the continuum of care of, pre-hospital, pre-care, to the discharge plan, to, the home care services. So I really enjoyed that whole process of helping clients from the beginning to the end.
That's wonderful. And the fact that you are a nurse by training, I think, allows you to talk to the geriatric care managers, some of the specialists in the area who sometimes are RNs as well.
Yes.
I assume you're not limited by geographic. You're in Connecticut, but do you service clients all over the country?
We do. We have clients all over the country. We even have clients internationally, but they're usually U.S. citizens, or they're transitioning from another country into the United States. So yes, and if we cannot provide services to a client within our, area of expertise, or in our, area of geographic area, then we will find someone who can help them.
Got it. And how would I find you?
At healthcarepathfinder.com or 203-656-2167, and info@healthcarepathfinder.com. No S.
Terrific. We are delighted to have you in our circle of influence.
Thank you, Kathy.